One thing that I would like to be clear about is that this flu is not particularly dangerous that's going around. Untreated, people are sick for about 5 days. Some people will be sick longer. I think the biggest problem with the flu untreated is it leads to a cough. And that cough can hang in there for a couple of weeks. Coughs really need to be treated. But so said, if you do get sick and you take these formulas, you can really reduce your length, the duration and the severity of your sickness, basically. Whether it's H1N1 or the regular flu or even common cold, we use the same kind of herbs. I took together some of these recommendations from China and made some formulas that, that address either an acute presentation or that we can use as treatment. If we look at the formula for acute, this formula I created for treating, the essence is going after the virus while at the same time protecting and promoting the vital qi. The trouble with any kind of fever is that it consumes your qi. And as your qi is consumed, it's harder to fight the infection. So our approach is to fight the infection and fight the virus at the same time. So in my formula, in my system, I use these D herbs. All these D herbs are cold herbs that can help fight virus. So we have Lophotherum donjuya, which brings down the fever. We have Phragmites lugon. We have Forsythia lianqiao. We have Linicera jinyinhua. All these herbs happen to be in the Yinqiao formula. So these are 4 herbs from the Yinqiao formula. We added into that Hutunia, Yuxing Sao, and Isatis Banlangan. So now we have a lot of the formulas just addressing heat toxins, viral heat toxins. All the other herbs help to deliver it. We have Fang Feng and Juhua and Bohe to get it to the surface. We have Gugen to relieve shivering. Now the use of the combination of antiviral herbs and qi tonics plus wind herbs is the general approach. And that's a formula I'm using for my patients to clear up the flu. One of my sons had the flu. I gave him this formula, and I'm telling you, within 24 hours, he was 80% better. Now, I don't know which flu he had, but he had a high fever, around 103. He had no sore throat. He had shivering and headache. In fact, headache was his first symptom. So I don't know which flu it was, but we gave him that formula, and by the next day, the fever was gone. He was 80% better. For prevention, the formula I'm using starts with the jade screen, Huang Qi Fang Feng Baiju. Now we added to that Pseudostellaria taizishen. Taizishen is an herb that boosts the qi, but also nourishes the yin. And it came to prominence in the 19th century for treating tuberculosis, where low-level heat would consume the qi, but they couldn't give normal qi tonics because they were too warm, and they would deplete the yin. So taizishen could enrich the qi and the yin, which incidentally was the reason American ginseng became popular in China in the 19th century, was it did the same thing. It boosted the qi and nourished the yin. So we added taizishen to the basic jade screen formula. Then we took herbs that are actually antiviral, following the Chinese approach that if you're trying to prevent it, you're probably being exposed to it. So we added in Isatis Banlangan lianqiao. We added in Juhua to reinforce bringing it to the surface. And then we also added in Agastache huaxiang to prevent heat from compromising a spleen damp condition and making damp heat. So it acts as a preventative. I would not take it all the time. I would take it if you think you've been exposed to the flu and you're trying to beat it. That's the nature of these 2 formulas. And we have it up on the screen so you can see what the composition is. So these last two formulas, we have a treatment formula, prevention formula. A lot of my patients have asked me to put something together, so I have. And if you want to get some of these two formulas, you can. They sell it in a tincture form. Now the reason we chose tincture, basically I use tinctures in my practice. I find the compliance good, the taste is not bad. You take 1 teaspoon and you add a little bit of boiling water to knock out the alcohol, and that's your dose, and you down that back. And that's the dose I would give everybody above 5 years old. Below 5, you have to give a little bit less. The real reason we did it in tincture form was because of the rush to get it out. A lot of people were suffering from flu, a lot of people were concerned about flu, so this product got manufactured in tincture form. But it's out there and you can get it if you want to. You can make it yourself if you have your own ingredients. You can go to the Ganmao Ling Zhonggan Ling approach. But if you're interested in looking at those formulas, as far as this whole topic, I have a more lengthy article on my website where I have an article about the H1N1 flu, how China's treating it, and so on. More of the information I talked about on this tape here, but obviously a lot more detail. So I guess my final words are that this flu is not that serious, but it is very contagious. And a lot of people are getting sick and they're getting the flu for 5 days or so. And these are the treatments that have been generated in China to approach this problem. And I can think of no better source for information about Chinese herbs than coming from China. So I hope this information that I shared with you is of use. Thank you for listening.